Welcome to H&HN Daily. I'm Susanna Hopsollen, Senior Editor for Hospitals and Health Networks magazine. Today, many physicians are frustrated by technology, often having to log into multiple electronic health records and applications to get a true picture of what's going on with the patient. What if we could simplify the physician experience? The University of Pittsburgh Medical Center Technology Development Center has done just that. Today, I'm joined by Casey Helfrich, Chief Architect, UPMC Technology Development Center in Pittsburgh, to discuss Convergence, a breakthrough clinical workspace for physicians. Welcome, Casey. Hi, thanks for joining us today.
It's very nice to be here.
Casey, can you describe for us, when a physician gets a new patient today, what's the typical experience like?
Well, in the background research that we did before we started this project, one of the common things that we heard from our clinical champions were that they felt more and more like detectives rather than clinicians as more and more technologies and solutions were introduced into the space. So instead of actually doing the diagnostic and clinical work and interacting with the patient, instead they were trying to piece together what that patient's story was, which silos of data or which combination of silos of data would provide them the base information that they need. We were data rich, but information poor.
When you designed Convergence, what did you envision that physician experience?
We wanted the physician experience to provide a unified tool that was intuitive to use, that provided the patient's story. And we also wanted a tool, the delivery mechanism that we're aiming this particular technology at is a tablet or handheld devices. Although we're not specifically tied to those, we've done a lot of design work to ensure that it is intuitive on those devices and takes advantage of what they bring to the table. And that is the ability to interact, to have a shared experience. In addition to abstracting, again, all of those different silos of data and providing a single pane of glass that really gives the physician the clinical context, the information that they need to do their job. It also encourages, just as we're doing, a face-to-face interaction so that the clinician can work with the patient. You have a better informed patient, hopefully a happier patient, and leads to better results. And then also from an evidence-based medicine and meaningful use perspective, we wanted to make sure that all of the solutions that we were producing were aware of the current regulatory environment, the future of shared risk, the future of going from volume to value, and making sure that our tool could actually help hospital systems along that path rather than fighting against it.
You've been working on Convergence for about 3 years, and going through all different kinds of phases. It's now ready for commercialization. Over the years, what kind of feedback have you received from physicians that really makes it that unique clinical workspace?
One of the key tenets, actually, of the project is we wanted to make sure that we weren't creating a rip and replace solution, because that's just simply not viable in the industry. We wanted something that would work in concert with your legacy investments. And there are, frankly, many things that a lot of the tools in the market do very well, and we don't want to take those away in any way. And so Convergence really sits on top and allows the clinician, again, to get that patient story, to travel down a pathway, practice evidence-based medicine, and then quickly and seamlessly jump into their legacy EMR to place an order and jump back and continue with their clinical workflow.
What are the benefits to the physician from this kind of tool?
Our hope and our goal is that it's intuitive and that it gets out of the way. I think it was Isaac Asimov said that any sufficiently sophisticated technology is indistinguishable from magic. I don't think that applies directly here, but I would take that in the sense that we don't want to create technology for technology's sake. We want to provide intuitive solutions that the technology ultimately doesn't matter, that it's about performing the clinical duties, it's about providing care, it's about getting better outcomes, it's about greater efficiency of the system, it's about healthier populations. So the technology should ultimately be invisible.
Thanks for joining us today.
Thank you.